presentation discussion, data-informed approaches to collaboration with youth and family, what the Children's Mental Health Initiative, or CMHI, data tells us. As Tiara just said, the PowerPoint and additional materials are available for download in the box at the bottom right corner of your screen. Just wanted to point out that in today's presentation, we're going to cover selected data points, but a slide deck that has the full data presentation that we provided at the Tampa conference, the 2019 USF Policy and Research Conference, is included in the additional materials for download. And we definitely encourage you to use the chat box to ask questions, to share information with each other, and to comment throughout the presentation on the information that we're sharing. We do hope to be able to open up, since we have a smaller group, for discussion toward the end. This webinar is hosted by the Family-Run Executive Director Leadership Association, also known as FREDLA, and we're a partner in the National TA Network for Children's Behavioral Health, which is operated by and coordinated through the University of Maryland, and is funded by the Substance Abuse and Mental Health Services Administration, or SAMHSA. For those not familiar with FREDLA or with our learning community calls, FREDLA is a network of family-run organizations. There are about 120 family-run organizations across the country, and they were all started by families caring for a child or young adult with mental health or behavioral health needs. FREDLA's mission is to build strong, sustainable family-run organizations and together influence policy and practice to support children and families. We are a partner in the National Training and Technical Assistance Center, called NTAC, and collaborate with both state and national organizations and offer technical assistance and consultation to family-run organizations, states, and other stakeholders. My name is Millie Sweeney, and I'm the Deputy Director for FREDLA. Joining me today are Malisa Pearson, Project Coordinator with FREDLA, and Brie Masselli, Youth Program Director with MOVE National. MOVE National is also a partner in the TA network, as well as a partner in the National Evaluation for System of Care sites conducted by WSTAT. We would be remiss if we did not recognize the individuals behind this work. A big thank you goes to those that helped us analyze and provide this data today. Natalie Tello of WSTAT, Alice Topoloff of MOVE National, and David McClung of the Texas System of Care in Austin. They spent a significant amount of time analyzing data and formatting results for us, and their efforts are much appreciated. To set the context for our discussion today, let's start with a brief review of what is required and what is evaluated in the Children's Mental Health Initiative funded sites in terms of collaboration and partnership. One of the core purposes of the System of Care initiative is to support improved collaboration between families, providers, and systems to promote better outcomes for children and youth, as well as a more comprehensive, seamless system of services and supports. This graphic illustrates the evolution of collaboration between entities, moving from coexisting to collaborating. Consider where the needle would be for you or your site or your organization and partners. Are you coexisting and just aware that you're doing similar work? Are you at the communication level where you share some information with each other? Have you moved to the coordination level and are participating in some joint processes? Or do you feel that your community has moved the needle to begin collaborating with each other, co-creating policies, sharing resources, and sharing ownership? This graphic demonstrates what we were looking for when analyzing the CMHI data. Specifically, we want to determine the level of collaboration between system of care communities and states with youth families and youth and family-run organizations. During the funding cycles that we examined, which were 2013 and 2014, there wasn't a requirement for a lead family contact or a youth engagement specialist. While they were not required positions, we are aware that several grantees hired lead family and youth representatives by choice. While these positions were not required, system of care values call for family-driven, youth-guided care to guide all levels of system of care efforts. It is best practice to have both youth and family task leads in your community, as their roles are critical in the foundation of your work to build a more collaborative system with youth and families. The CMHI evaluation during 2013 and 2014 collected data through both stakeholder interviews and standardized tools. The evaluation components that we were most interested in involved engagement and collaboration with youth and families, as well as with youth and family-run organizations. Evaluation components focused on those areas involving examining youth and family engagement at all levels, the presence of mechanisms to promote and sustain youth and family involvement, and the extent to which services are delivered within a youth and family guided framework. Also assessed were the impact of system of care services on involved individuals and factors associated with successful expansion of the system of care philosophy and approach, including partnering with youth and family-run organizations. Now, let's get to the actual analysis and what we learned from the data. I'm going to turn it over to Melissa.
All right, thanks, Millie. As Millie said, my name is Melissa Pearson. I'm a project coordinator with FREDLA. I want to start by just kind of helping you identify kind of what we were looking for as we analyzed the data. And our goal of the analysis was to answer these three research questions. First, what does collaboration with youth and family organizations look like within a system of care? What are the services and supports that youth and family-run organizations offer, both within systems of care and more broadly? And what benefits and outcomes are as a result of the collaborations at an individual service and policy level for systems of care who collaborate with youth and family-run organizations. Next slide. We analyzed, as Millie mentioned, 2013 and 2014 data collected by WESTA as part of the CMHI National Evaluation. We focused on the results from two tools in the national evaluation cadre, and those were the stakeholder interviews and the self-assessment of implementation survey. These were developed to assess expansion efforts within systems of care at various levels, including activities youth and families and youth and family-run organizations participated in. For the stakeholder interview data, this included 35 federally funded CMHI grantees across 25 states. The stakeholders who were interviewed were project directors and youth and family representatives. Those youth and family representatives may have been the family and youth leads who were employed within those systems of care, or they may have been youth and family representatives serving on governance or other committees. For the self-assessment of implementation survey, there were 34 federally funded CMHI grantees involved in the data that was analyzed. And across those, there was a much larger pool of respondents that included the project director, family and youth representatives, but also other stakeholders, including stakeholders representing systems such as mental health, child welfare, juvenile justice, education, their evaluators, quality improvement monitors, et cetera. For this tool's data for 2013 and 2014, there were a total of 25 youth respondents and 32 family respondents in that data. We also looked at data that MOVE National and FREDLA gather through annual reporting processes through surveys that we both do. And across those surveys, we have some common measures that allow us to be able to do this type of analysis, to be able to cross-reference the types of services and supports that are happening within youth and family-run organizations. For the purposes of FREDLA's survey, we interviewed family-run organizations, and we use a definition of family-run organizations that includes an executive director, is a family member with lived experience. Their governing board of directors are made up of more than 50% families with lived experience. They're incorporated as a 501c3 nonprofit, and they have a primary mission to build strong, sustainable family-run they have a primary mission to support families supporting children, youth, and young adults with mental and behavioral health needs. For the purposes of the Youth MOVE National data, they were surveying Youth MOVE chapters that completed annual report requirements. The chapters may be independent 501c3s, or they could be housed within a host agency. They could be statewide, county, or agency specific, and they operate under one of the chapter purpose areas that Youth MOVE National has. Next slide. So our first finding that came out of the analysis of this data really focused around how system of care communities could benefit from collaboration with youth and family-run organizations. And while some of the communities and states that we looked at in this data were formally contracting and collaborating with youth and family-run organizations, either through a contract or an MOU or something of that sort, we were pleased to see that all of the respondents indicated that there were additional opportunities for strengthening those collaborations. So what we mean by that is that when we looked at this data, the majority of the respondents, over 60%, indicated that while they had some formal agreements happening, there were either things that were planned that hadn't yet been implemented, or they hadn't identified all the opportunities that could happen. And so when we looked at that, it told us that there was a lot of opportunity out there for family and youth-run organizations to be playing a greater role in system of care efforts in communities. Next slide. The second finding that we looked at was around the responsibility of youth and family-driven practices being placed on youth and family representatives or leads within the communities that employed a family or youth lead. And what we saw across the data was that there was a lot of emphasis placed on the youth and family leads to really be the responsible person around all things family and youth. Meaning that for systems of care, oftentimes the family and youth involvement that they reported on was the youth or family lead serving on committees, governance, councils, those kinds of things. And while we would, of course, support and we're pleased to see that the youth and family leads were serving on these committees and councils, again, it kind of elevates that additional opportunity for involving other family and youth as well, so that we're really ensuring we have that full family and youth voice across the system of care operations and governance levels, and we're getting a really nice diversity of perspective and expertise from families and youth. The other piece that we saw pretty clearly underneath this was that there's a wide variety of roles that family and youth can play and family and youth-run organizations can play. And so by partnering with family and youth-run organizations, it really helps not only support the family and youth leads within these systems of care communities, but it increases the capacity that is able to be covered within that community and really allows that community to ensure that family voice and youth voice is infused across the board at all of those levels, at all of those stages of development. So I'm going to hand it off to Brie now to walk us through a couple more of our findings from the data analysis.
Great, thank you, Melissa. So as we think about youth and family and voice at all levels of system of care governance is kind of a foundational component of where youth and family voice can advise and support with the design, implementation, and oversight of the system of care. So the graphic you're seeing here today, this chart shows that while stakeholders indicate there are strategies supporting the involvement of youth have not been very involved in the past 6 months in systems of care governance. Approximately 75% of the respondents reported youth have either not been involved, a little to moderately involved, or did not know about youth engagement. And a small percentage of 22% have been involved extensively. This could be done unintentionally due to the design of the structure of youth programming. And so oftentimes a youth program is part of another overarching program. So when you think of the makeup of the decision makers in higher leadership positions, they often get invited to the table. And so unintentionally, if a youth leader or a youth coordinator is not at a higher equitable level, oftentimes their voice is not at the table, and it is their supervisor who may be at the table representing that voice. And I think that's done unintentionally, but yet an area that we would be able to make sure that we have authentic youth involvement by having equity and having their role at the table versus another person delivering those messages, which is really important as we move forward. And again, here you see the family representative involvement in system of care governance within the last 6 months. So as you can see here, 36% noted extensive involvement of family representatives in system of care governance. However, approximately 60% of the respondents indicated family representatives had little to moderate involvement or they did not know. 36% involved were uninvolved even though there are strategies in place to support that involvement. So again, these are just considerations when we think right from the very foundational level of designing the system of care. These governance bodies serve as a mechanism to really innovate what is done with the grant, provide oversight, provide feedback and decision making, and we really, best practice would show that youth and families really need to be an integral part of that decision making and oversight body. So with that being said, I'm going to turn it back over to
Thanks, Brie.
Melissa.
Thanks, Brie. This next finding was really around the involvement of youth and families in services and supports offered. And that involvement is pretty limited. And what we're seeing is there's a few reasons that came up in the analysis of the data. Youth and family, of course, need to identify and shape the service array. And by engaging youth and family-run organizations, we can enhance and expand the service array for a full system of care by really improving the service array beyond just, clinical services and traditional services. They can really help bring to bear those natural and more community-based services. But some of the challenges that some of the communities identified were, first and foremost, that oftentimes system of care grants are seen as service delivery vehicles. And so as such, rather than being seen as culture change vehicles or opportunities to really change the philosophy, the approach, and the values that drive the way we service and support children and families, it really kind of limits the ability for us to think about how we can infuse youth and family across all of the different levels within a system of care. And so as such, youth and families are oftentimes seen more as recipients of care rather than as the experts and decision makers of their care. And so, which very much falls in line of communities seeing this as a service delivery vehicle, most frequently seeing it as an opportunity to really either implement or expand the opportunity to deliver wraparound to families and youth. As we analyzed more of the data in the stakeholder interviews, we found that there were actually limited specifics around related to the sustainability of youth and family positions and support for youth and family involvement and engagement across the initiative. And again, if we go back to what we started with, seeing this as more of a service delivery vehicle rather than a culture change vehicle, that makes a lot of sense. But given finding that in the data, it again raises opportunities for us to shift kind of our approach as to how we engage youth and family and how we view the system of care as a vehicle to change the way we do business rather than to expand the service array that we offer to children, youth, and families. Next slide. When you look at this slide, this is really a slide that lists a lot of different services and supports that are available within systems of care. And what will really stand out if you look at the different services and supports that are listed on here is that first and foremost, they're mostly all clinical interventions, with an exception of a handful of them. They're all mostly all the required services and supports that SAMHSA requires be available within a system of care. But there's not necessarily as many informal supports and services. There's a lack of integration of family and youth within the workforce level, if you look at this list, and there's a lack of integration of family and youth voice at the management and governance level. So these factors all play a role in how the system of care determines what services and supports are available. While there are strategies in place to ensure children, youth, and families are served in their home communities, such as parent-peer support and youth-peer support, when we looked at the self-assessment implementation survey data, all of the respondents told us that while there were strategies in place around peer support for families and youth, there were still a lot of opportunities, even in the communities that were providing peer support, to really expand the full array or the full access to that peer support. And in a lot of other communities, it was either only in the planned stages or it was in the not planned or I don't know stages of the respondents' data reporting. So again, everything from, one, ensuring that youth and family are aware that peer support could be an option in the service array, all the way to opportunities for collaborating with family and youth-run organizations, which, as we all know, do a lot of provision of peer support services, both for family and youth in communities. And so that could be another opportunity for engaging them to really build a more comprehensive array of services and supports that we make available. The next slide. This next slide is really looking at youth and family-run organizations and how responsive they are to the needs of communities and states. And it really articulates the ability for family and youth to play a critical role in a system of care because of the breadth and depth of services and supports that they routinely deliver through their organizations. And family and youth organizations have the capacity to offer meaningful and significant services and supports. They provide a diverse array of programming that meets families and youth where they are. They also provide a lot of diverse expertise and lived experience through their staff as well as the families and young people they serve. And they are often the support needed when families and youth struggle with navigating complexities of the formal systems. So in many, many ways, family and youth-run organizations could be and should be integral partners and stakeholders within system of care communities. So if you look at the data, and this data under family services and supports offered is driven or drawn from the FREDLA survey data that FREDLA does approximately every 2 years. And the family-run organizations who completed that survey, of those, there was about 65 organizations from our last survey who completed this. 95% of those delivered parent peer support. 98% of them provided systems navigation. And 93% of them offered trainings for families and providers. So you can see, just by looking at that data alone, the multitude of opportunities where families and youth or family-run organizations could support the efforts of a system of care. Just in that delivery of parent-peer support, helping families navigate the complexities of the multiple systems that they oftentimes find themselves navigating with children with mental and behavioral health needs, and in helping train the workforce, both the family workforce, but also the broader behavioral health and mental health workforce and other child-serving systems. And these are all things that the family organizations that we surveyed said they routinely do on a day-to-day basis, on a monthly basis, on a yearly basis. So this is something they already have the capacity for and would be very, very easy to bring to bear within a system of care community. Brie, do you want to talk a little bit about what you guys found in your surveys?
Sure. So obviously youth engagement and our youth MOVE chapters are newer than family-run organizations, and so you'll see some of the things that our chapters focus on is a little different than the family-run organization, and I think that's done based on capacity of individuals. So a lot of our chapters provide very direct services to the actual individuals who have a mental health diagnosis, and they work with them on leadership and how to utilize their story to really be empowered within their services. And then we see a lot of community outreach and stigma reduction, really trying to normalize that mental health is important and part of whole health. And so those are really our primary kind of top focuses. And then we obviously see many young people with behavioral health challenges are often excluded from traditional positive youth development programs, perhaps because of behavior or age or lack of access. And so a lot of our youth MOVE programs really create and nurture that safe space for young people to feel connected to other peers. And so those are really popular for our chapters. And then you kind of see the reverse around more direct, systems trainings and or formalized services kind of get a little smaller, but we're seeing things grow and shift as our chapters are a little bit more supported, more developed, and have been around a little bit longer. So, and I'll turn it back to you, Melissa.
Thanks, Brie. All right, next slide. So the last finding we wanted to kind of highlight for all of you is that we noticed very clearly that different audiences define collaboration differently. And if you think about the graphic that Millie started with early in the presentation between, coexist to collaboration, we saw very clearly that for families and youth, they operationalize collaboration differently, and their expectations of what collaboration looks like are different. And so, for an example, many of the community members reported that they had really good family and youth representation at all levels of management and governance. But when we were able to kind of comb through very, very in-depth through the stakeholder interviews that are done one-on-one with project directors, family and youth representatives, we were able to kind of peel that back a little bit further and dig a little deeper. And what we came to see was that many of the stakeholders define collaboration as having the family and youth lead on the management and governance level. Whereas for families and youth, they didn't rate that level of collaboration as highly because only the family and youth lead were engaged at the management and governance level, and there weren't additional families and youth representatives serving or sitting at that level and influencing decision making. So that told us a lot about that, there are different expectations, different definitions from different stakeholder audiences around what collaboration is and what it should look like to consider that collaboration is happening. Another piece that was pretty clear to us was that the system of care approach and philosophy can be pretty difficult for stakeholders to understand, especially those components around family and youth-driven aspects, not just family and youth-driven care, but especially how do you build family and youth-driven services and supports and family and youth-driven policies, practices, and procedures. And so it aligned very, very much with the earlier finding where we saw that people were seeing these grants more as a service delivery vehicle than as a culture change opportunity. And partly because it can be very nebulous around, how do you operationalize family and youth-driven care within a mental health system versus within a juvenile justice or an education system, and so on. So it really kind of elevates for us that need to really help support not only youth and families around what it means to have their voice and expertise infused, but also all of the stakeholders across the system of care to really better understand what it means to utilize and implement a system of care approach and philosophy to doing business. And the last piece is really around the opportunities for families and youth to be involved in developing policies and procedures. And when we looked at the stakeholder interview data, what we found was that while there were a lot of families and youth serving on advisory councils, there weren't as many family and youth serving directly, as I mentioned before, on those governance, management, and decision-making level bodies, such as the Finance Committee. And so, again, we were really excited about the opportunity to see family and youth, advisory councils and how those could feed into those decision-making processes, but wanting to really encourage and support communities to kind of take that next step to move families and youth beyond an advisory capacity to really helping be equitable partners in the decision-making and really empowering them and the broader community to see them as such and really see the value and benefit of having families and youth engaged at that level at the decision-making tables. So I'm going to hand it off to Millie to talk a little bit about some strategies that we can use to move these things forward.
Thanks, Melissa. We drew two main conclusions from the findings from the CMHI data and from the surveys that Youth MOVE National and FREDLA do. The first is that family and youth-run organizations offer a pretty diverse array of services and supports that can enhance youth and family voice at all levels of system of care expansion. They usually help fill gaps in services and support families in navigating systems to access those needed services. Secondly, systems of care expansion grants could do more to maximize resources, services, and supports that are available in their communities and states by meaningfully collaborating with youth and family-run organizations. There are several system of care sites that formally partner with these organizations and involve youth and family leaders in their system of care efforts. I would like to see maybe the next thing we look at is how is there a difference between those that do formally collaborate and those that are just beginning to have those conversations around collaboration and have not moved the needle as far as they could and they will. So based on what the CMHI data tells us, there are opportunities to strengthen collaborations in system of care sites with youth and family-run organizations. We'd like to provide a few recommendations and ways to strengthen and formalize such partnerships. If you have existing partnerships within your community, these can be used as talking points and advocacy messages in your community. If collaboration is not currently happening or could be improved, these are potential ways to strengthen your efforts. This graphic is adapted from Carmen and Associates and showcases the variety of roles and functions that youth and family can fill in a system of care. These fall into 5 main categories: inform, consult, involve, collaborate, and empower. Under each category are examples of a role, task, or function to be filled by a young person or a family member. For example, they can inform the development of fact sheets or brochures, or be involved in training as a co-trainer or facilitate groups. There will be youth and family members that are interested in filling roles under each of these categories based on their readiness and their desired level of involvement. However, underlying all of these roles and functions are basic values that need to be in place, and they should be in place in the system of care. Trust and transparency, safety, empowerment and choice, collaboration, mutuality, cultural responsiveness, and peer support. These roles can all be implemented in many ways: as part of someone's job responsibilities as lead youth and family contact, who may organize a youth and family group, as stipend work for youth and family leaders, or fall into a more structured partnership with a youth or family-run organization via a contract. Most importantly, however, is that these can all happen at the same time. It's not a linear process, and more about the task at hand and the developmental process of skill and growth for youth and family to feel ready to step into some of these roles. Perhaps the most effective way to engage youth and families at all levels in a system of care and in all these functions is to contract and partner with your local and state youth and family-run organizations. They are structured for and have tons of experience in this realm, as well as being connected to established networks of families and youth in your community and state. Family and youth-run organizations can represent, engage, and involve many youth and families, fulfill roles at the child, youth, and family level, as well as the system and policy level in their states and communities. They can provide perspectives from people with lived experience to improve services and systems. They can recruit, train, mentor, and support family members and youth for policy and system-level participation. They can also recruit, train, certify, mentor, and support family members and youth for roles at the service delivery level. They provide training to all stakeholders, families, youth, and professionals. And they can lead and participate in social marketing and strategic communication efforts. Let's talk specific strategies to strengthen work and collaboration with youth and families, as well as youth and family-run organizations. In your system of care work, educate others on the benefits of working with youth and family-run organizations to build and operationalize family and youth voice and leadership, as well as impact policy that supports such partnerships. Work to expand the service array by building capacity of youth and family-run organizations for the peer support and systems work that they offer. Establishing formal partnerships with family runs and youth runs is an effective way to accomplish these things and to infuse youth and family-driven efforts throughout a system of care. Use mechanisms such as contracts with specific scopes of work and MOUs, or Memorandums of Understanding, that outline contributions and responsibilities for all partners. Again, these are ways you might strengthen and formalize partnerships. For example, if you have a current MOU, transition that into a formal contract. Or if you have a current contract for parent peer support services, expand the contract to include training and technical assistance on family engagement. It's critical in collaborative work to ensure that appropriate resources are allocated to accomplish the work that needs to be done. This applies to funding, materials, and time necessary to build family and youth programs and organizations. It also applies to equitable allocation for roles and resources for the youth task lead, not just the lead family contact. System of care language is usually stronger for the required family position than the youth position, and system of care sites should model equity in those positions, roles, and resource allocation. Data is powerful. Plan now to collect quantitative and qualitative data on family and youth involvement, activities, and outcomes. Identify how you can use this data along with youth and family voice to sustain youth and family-run organizations and their work beyond the federal grant. Develop and implement CQI, or continuous quality improvement processes, that support and promote the growth and maintenance of this work. Also, actively support the incubation of emerging youth and family-run organizations in your system of care if they do not currently exist, through financial support and technical assistance around organizational development and operations through the system of care funding. If there is an existing family-run or youth-run organization, support their efforts to incubate youth programs or to incubate an emerging youth organization. I'm going to turn this over to Brie to cover some more strategies. Brie?
Thanks, Millie. So additional strategies for inclusion of youth and family is to increase your partnerships with the youth and family organization with effective methods of increasing youth and family engagement. So thinking about your service delivery model and thinking about how within the service delivery model can young adults advise, how can family members be a part of the service delivery, considering all of your training and technical assistance and monitoring all of your system of care trainings to be co-facilitated by a family member and a young adult lead, or how can you create opportunities for youth and families to be embedded within those trainings through digital stories and other ways that you can assure that youth and family voice is throughout the implementation and the delivery of your training content. Consider utilizing youth and families as members of the management and evaluation team. Oftentimes within our system of care, you have your national and you have your local evaluation, and it can be overwhelming and intimidating to have a researcher knock on your door or sit and ask you a lot of very personal questions. So how would you be able to partner youth and families with your evaluation team and allow them to conduct the evaluation and really kind of build that sense of safety and understanding from another person with lived experience that can sometimes often soften the complexities of outreach and retention for national evaluation. It's also a good way for youth and families to inform you on how to conduct meaningful evaluation. We often hear that youth and families are assessed and questioned out, like there's so many surveys to complete, there's so many things you don't understand what people do with this information. Those youth and families can really help advise you on how to really get the biggest bang for your buck and structure your evaluation protocol to get the most out of it versus asking a bunch of questions that maybe you're never going to analyze in a way that makes sense for them. There's also in your downloads, there is a guiding questions for youth and family engagement to assess kind of where youth and family engagement is within your system of care work. And youth and families should be engaged at every level of that work. So as we mentioned throughout today's presentation, the administration of the grants, identifying how resources can be allocated for what parts of the system you're hoping to expand upon or introduce into the community. That might be a new service array, that might be training new clinicians. Millie already touched base on some of the continuous quality improvement pieces. Really thinking about asking, is what you have working and how youth and families can advise you, and perhaps you can facilitate focus groups that you can gather that voice and go back to your system of care and say, let's invest the money where youth and families really need the support and service, rather continuously investing those dollars in services and supports that they're not using. Utilizing personal lived experience to support with advocacy messages and policy development, as well as outreach to hard-to-reach youth and families, or families that might have been burned by the system before and they're a little weary of getting back involved, and how that family-to-family connection and youth-to-youth can really support that outreach and engagement into the system of care services. Another would be to expand the service array based on youth and family identified and preferred supports. So we often hear that there's wait lists for formalized services. So what do youth and families have in the interim before they can get into services? Is there a role for a youth-run or a family-run organization to provide some interim support until they can formally get involved into that more clinical intervention or see the therapist that they're looking to work with or to get access to wraparound services? So really thinking about how these informal supports really can be a lifeline to families that are really in need in the moment, but maybe can't access appropriate services, or maybe those clinical services just really haven't worked and they need additional support, and that looks very different, and that could be group support through family support groups or youth groups. That can be really helpful. Again, one of the largest kind of trends we're seeing now is really having your system of care and or your behavioral health entity that is managing your federal grant to really partner and contract with family-run organizations and youth-run organizations to really be the administrators and the providers of the youth and family peer support services. So really engaging them and then having them kind of design that service, implement that service, and deliver the service. And that's also another way, again, where the formal service gap might be. Maybe perhaps you can't get into the service, but you can get assigned to a family peer right away for family support, and that can all be very supportive. Train all stakeholders on system of care, on youth and family-driven care, and what meaningful youth involvement looks like. Avoid tokenism or the use of staff. And that's just really important to really think within your community. We talked earlier about maybe there's enough within the grant for a person, and while one person isn't the voice of the whole community and the youth and families that are involved within that community. So really thinking about how to not put all of the responsibility or all of the pressure on just one staff position, but how can they mobilize and partner with additional family voices to really bring the collective perspective back and represent throughout the system of care. Thinking about how you're able to really establish a quorum in decision-making groups based on non-staff and staff. I know in my own personal community, when I was at the system of care local level, we had a percentage, like our bylaws within our governance structure said 60% needed to be youth and families, and part of that 60% might have been a staff member, like myself. I was the youth coordinator at the time, but I didn't have voting privilege. I had to make sure that other youth there were at the table so that they could have a meaningful vote because I was a staff that was paid by the grant, so it felt we didn't want to weigh down the voices. We really wanted it to be true representation. And so thinking about how you can develop those guidelines and mechanisms in place so that it really truly feels authentically driven by your families and your youth that you are involved in your efforts and not solely just formalized staff. Their voice matters tremendously, but wanting to have the full collective is really important to the work. And another strategy is we often think of system of care meeting medical necessity, and there's a lot of what youth and family-run organizations offer that really fall under a more preventative outreach and capacity building that really falls under a public health approach. So really trying to prioritize prevention for the positive long-term outcome and really thinking about when families and youth can get involved sooner, they can feel supported sooner, they are empowered to make better health decisions and treatment decisions related from that preventative way can really help us think about sustainability and positive outcomes for the long haul. And so it's really important for some of this to really definitely take a public health approach as well as, the traditional behavioral health. We can only help you when you're in dire need because we have to categorize that medical necessity, so we could bill for it, which doesn't always help in the moment, and it leads to a different sustainability strategy than some of what our youth and family-run organizations offer. And so it also opens up another whole system and pot of funds that can help you sustain your work in a little bit of a different way. And with that being said, I'm going to turn it back to, I think this is Melissa.
All right. Thanks, Millie and Brie. I want to wrap up with helping you think about how you can really build youth and family collaboration measures into your local evaluation. As many of you probably are aware, moving forward, the national evaluation has been reduced, and so it's more important than ever for, as you're developing your evaluation mechanisms and measures that you're going to use, to think about how will we pay attention to these things? How will we measure these things that are important to us, which is how are we really collaborating with youth, families, and youth and family-run organizations? And so these are some common tools that we've seen across the country be used to evaluate some of these things and are just, tools for consideration. Millie and Brie mentioned some of these, like surveys and focus groups and discussion groups. You can use things like the CANs and the FANs, the caregiver strain questionnaire, and the protective factor survey are all really good tools that can really help kind of look at what's important to youth and families, and do they really feel like they're benefiting from things, that they're getting the support that they need, and that their voice is being heard. Specific tools that can be used for system of care. Brie mentioned a minute ago those guiding questions for youth and family engagement in system of care. Those are available for download, and they're wonderful, wonderful resource to use to kind of not only evaluate, but also to look at to see, where are we with these things in our community right now, and where are there opportunities to strengthen collaboration. And it offers some guidance and some ideas around some ways that you can continue to move the needle towards full collaboration with youth and families. The national evaluation tools, of course, like what we've analyzed, the self-assessment implementation scale and the stakeholder interviews. And then also, specific to the family and youth-run organizations, it's really critical for you to be measuring your impact and your reach as well. As you're collaborating and as you're working within the system of care communities, thinking about how you can be also building these measures into your evaluations within your work around the training that you're doing for professionals, families, and young people, the outreach activities that you do to really engage families and youth and gain that diverse expertise and perspective that you can bring to bear within a system of care. The impact that you're having through the peer support that you're providing on, school performance, decreased interactions with law enforcement, those types of things, so that not only are you continuing to measure the collaboration between families, youth, family and youth-run organizations and systems of care, but also the impact that your organizations are having as it relates to the sustainability and longevity of the work. And then specifically around family and youth voice, there is an agency-level decision-making and advising tool called the YVAL that Youth Move National developed in partnership with Portland State University and their Research and Training Center that's available, and that really looks at meaningful youth voice at the agency level and decision-making level. And then two additional tools that are in pilot right now, the YVOC and the FAMVOC. And there are some resources, again, in the downloads for you guys to be able to download to get some more information about those. The FAMVOC is really, and the YVOC are looking at meaningful family voice and meaningful youth voice on councils and committees. And so these could be tools as you work in your systems of care to think about how you assess meaningful youth and family voice on your governance councils and on your sustainability work groups and things like that to really determine where are we, where do we want to go, and how can we get there. And so these tools can not only be a way to assess the support that is being provided for meaningful voice, but it also, these tools are built around best practice principles for how to engage youth and family and really support them effectively to use their voice and be empowered and be supported meaningfully for them to bring their expertise and lived experience to those tables. So those are things to kind of be watching for, and as they move forward, Youth Move National and FREDLA both will be making sure that we keep you informed about those tools and that we're working on, and we'll get those out to folks as they become available. Next slide. The last thing we want to kind of leave you with before we move into questions and answers is to let you know that, we're here to help. You're not alone in this implementation and in the work that you're doing. Youth Move National and FREDLA both are a resource to you as national organizations and as training and technical assistance providers. We want to be a resource. We are always happy to help if you're running into any challenges, if you're exploring strategies to expand the collaborations that you're having within your communities. If there's anything we can do to support you in your efforts, we definitely want to do that, and we'll make sure to provide our contact information is in the PowerPoint slides that you can download. You also have access to the TA network that Millie mentioned at the beginning of the presentation that both FREDLA and Youth Move National are core partners of. They are federally funded as a TA network for you for federally funded grantees and non-funded grantee or communities. So you do not have to have formal federal funding to take advantage of the TA network and the resources that they have available. So if you have things that if you're wanting some expertise on something such as, finance or something along that realm, and you feel like the TA network might be a better option for you, that's definitely something you can take advantage of. Or if you reach out to Youth Move National or FREDLA, we'll also help link you to the TA network so you can tap into that. And then last of all, for folks who are federally funded, you always have the ability to access your general project officer or your government project officer, and ask for support and technical assistance from them, and they will definitely help link you to the right place as well. So there's lots of support available for you, and, you know, we would love to be a resource to you. So I am now going to, Tiara, I don't know if we want to open up the lines for folks if they have any questions. We'll also, or you're also welcome to put your questions or comments in the chat box if you'd prefer. And we will answer any questions that have come in during the presentation or moving forward. Did we have any questions, Millie or Brie?
Mm-hmm. We do have one about maybe examples from communities with well-functioning youth and family advisory councils. And there's one that comes to mind that I've heard Johanna speak about, and Brie, I don't know if you were aware of it. I think it's Washington that has the youth councils that are set up.
Yes. Yes. Did you want to keep talking about it, or would you like me to mention about it?
Yeah, if you could just kind of mention that. And
yeah.
I do believe there are some on, Phoebe talked about, Phoebe Malloy is also on here talking about one of those.
Washington has a really great structure, and the structure that I've been working the most with is actually in Colorado. So their system of care is working within 16 counties, and each county has what they're calling kind of a center of excellence hub, and each hub has a very strong oversight advising committee, and each of those has youth and family on it, as well as an advisory group of young people that advise and participate in activities outside of their advisory structure. They've had multiple rounds of system of care, but their youth program right now, they have a identified youth advisor who is kind of like the part-time staff person in each of those 16 counties, being supported by an overarching, like, statewide youth engagement support. So I would highly recommend Colorado. Washington kind of has the same structure. One thing with advisory council structures that I think I just want to be mindful of is that sometimes an advisory structure is very helpful, and other times it can be discouraging for youth and families to be on an advisory council because they feel that their voice is only serving in a recommendation to a greater board, and they still don't have decision making. And so I would just be careful with a governance structure has voting and decision making capabilities, where an advisory committee might just bring forth a recommendation, but it doesn't always have the same pull depending how you structure that in your community. So I would just be mindful, no matter what you want to call it, it really comes down to, do we hear youth and families? Do they have equitable voice and choice in the decision-making process of what's happening next? And so those are important things to consider as you're trying to develop them.
Thanks, Brie. I was curious, and Tiara, if you could chime in about how the process works about opening up in just a second, but I was curious if anything from this data jumped out at folks that was surprising, or it lines up with your own experience in system of care. If we could open up the lines, and Tiara, if you'd let people know the best way to do that.
So I'm going to go ahead and take off the mute. I just want to prepare folks to make sure that their phones are muted if they don't have any questions. So just be sure that you do hit that mute button on your own telephone if you don't have any questions or don't want to chat with our presenters today. So I'll go ahead and open up the lines now.
So does anyone have reactions to this data? Does it fall in line with your experience? The lines are open, so you can unmute yourself and comment, or if you have other questions.
I just want to say that we have a family council. We have youth and family representation on our CLT. And I'm also a family partner. I'm a family advocate, but I do have 2 children with special needs. And I would say that we do listen to the family and the youth, and a lot of what they're telling us, we're trying to change the culture of the way everything is done. More cultural competencies, more family involvement, just the way system providers are speaking and approaching families. And that comes from the youth and family voice being heard and changes occurring. That's all.
It's really great to hear. Where are you from?
Fayette County, Pennsylvania.
Great, thank you.
You're welcome.
Millie, this is Monica in New Mexico.
Hi, Monica.
Hey, Delphi and I were just kind of talking to each other as this was going on, and with some of this data collection that you have here, like if we wanted to have this like collected within our own states, would you say this should be the responsibility of our, of our system of care or our state, or is it the family organizations that are collecting this data, or is it just multiple sources?
Well, I would say ideally it would be multiple sources. However, the ones that are closer to the family and youth involvement work obviously are the family-run and the youth-run organizations that would be more likely to get the information. We always suggest that folks look at their local evaluation if they're involved in a system of care, and how can you weave in some questions and some measures of youth and family engagement and functional outcomes and peer support into that local evaluation. That's where you have the opportunity. The national evaluation is very structured, but the local evaluation is where you can make it fit your community.
Oh, yeah. Okay, yeah.
And another thing to consider is national outcome. The national evaluation is very outcomes driven. They want to see clinical improvement. So it really, again, measures at that direct service level, and that's why they're conducting these like really in-depth interviews with people that are receiving wraparound or in the service. What you'd want to consider with your organization is a process evaluation, which is what WestStat and some of the data we presented on really helps you get at. What about the process, and how have youth and families been involved in the process of designing, implementing, and oversight? And that's why you see within the data we just shared is what is their voice in management and oversight? What is their involvement within governance and decision making? What roles do they play? Are they at the direct service? Are they doing training and technical assistance? And so that is more process type evaluation, not necessarily outcome. And that's why it's so important, because process evaluation is going away within system of care. So without the federal mandate, there's no other place to capture it unless you are, as a family-run organization, and can share a report back to your partners, or your community needs to. And you can help inform what would be most important to capture.
Right. Okay, that makes a lot of sense. Thank you.
Yeah. Yep. I would also say the guiding questions that we've referred to a couple of times, Youth Move and FREDLA got together and went through the funding announcement, what system of care sites are looked at for each different areas, like in governance, in service array, and we have questions for each one of those areas that folks can walk through. That there's questions and there's sub-questions. It's like an 11 or 12-page document. But you can walk through and ask those questions and use it as a check on how are youth and families being involved at every level, and how can we get better on this. You could even say, here's where we are now, and then look at it again and say, here's where we've improved. So it can give you some points of discussion. And a way to start brainstorming about how to improve in that area.
Sorry, I came in late for the presentation. Was that at the beginning of this presentation, or is that something we can access through FREDLA's website?
It's a download in the download pod. Mm-hmm.
Awesome.
It says final guiding questions. I am going to put in the chat box, there's the link to resources and all kinds of things that you can use that might answer some of the other questions that I've seen through here or give you a starting point for the TA network is part of the Institute at the University of Maryland. So the learning communities and online training and that sort of thing are also available at that link.
Perfect, thanks.
Additionally, we have other resources that are part of the final slides for this presentation that you can pull up. So Phoebe had a question that I'm not so sure that I don't know that I can answer this. And Brianna, you're more involved with the evaluation at the national level. You know, you actually do some of the evaluations. She wanted to know the average time frames for system of cares to move from theoretical research and philosophical to actual implementation. I would say that really varies based on the site.
Yeah, I think that is a great question, and it is something that is so thoughtful, and there's not a concrete answer. I have seen, and it's different by site, it's different by state. Some communities are currently funded. Others call their community behavioral health system a system of care. So how you define system of care, I think, really shifts at the local level. I think it also shifts by leadership. And so when I think of a theoretical framework of like these guiding principles and the values and making that part of your everyday culture, every time there's a staff change, you lose a little bit of the theoretical and have to go back and educate a new staff on what it is and how to do it consistently. And so I feel that that is a constant learning goal within the workforce and within the community that you can constantly have to be intentional about. In my community, we had a change at our Division of Behavioral Health. The old director got it, the new director struggled, and then it took a little bit of time. Change in leadership and your government, like a new governor could really shift things completely different. And so I would never say you're going to get there. You are always going to be on the journey, and you're always going to be teaching the theoretical, and you'll be doing that at different levels consistently. And it just has to be part of your community's approach.
Yeah, I think that's. I would agree with you, Brie. I think that it's an ongoing evolutionary process that takes place in every community, and every community is starting at a different place when they start. And so I think that plays into, how quickly or how slowly, and then you've got the political climate, you've got the cultural climate, and, the agency climates, and there's so much that goes into the change process that has to transpire to really create the kind of culture change that is intended to occur within a system of care. We fund these communities for 4 to 5 years to do this work, but I think that any community who's done this work would tell you that you're by no means done at the end of your funding. You still have a great deal of work to do beyond the life of the funding, and so that's why that thoughtfulness and intentionalness that has to take place around sustainability is so important, and that you don't think of sustainability as just money, because the sustainability that's really critical around this transformative process of moving to a system of care philosophy is around those values, behaviors, and attitudes that have to shift. And so it is, how do you sustain that true family and youth voice at all levels? How do you sustain those champions at all levels? How do you sustain that philosophy, that theoretical, that those principles at all levels, because you can find money. The other stuff is the stuff that's really around what makes the culture change happen. And if we don't sustain the ability for youth and family to be involved at all these levels, we really can't truly get, to system of care.
Yeah. And that is so true, Melissa. And Brie, just one second. Before, I wanted to add on to that is that if you move from philosophical, you have to constantly push to say, how do we operationalize that? If we want people to involve youth and families in the work that they do and collaborate, then perhaps one way is to build it into contracts so that it's a requirement, not just an expectation. Constantly push for how do we operationalize each one of these areas where we want family and youth involvement if we want to be truly youth and family driven. I'm sorry, Brie, go ahead.
Yeah, no, one way to operationalize it is to document it. And so I don't want to discourage people to think that like it's so hard and that it's a big overwhelming job to do, is that whenever you want to replicate something, you need to operationalize it, and when you've done a good job operationalizing it, you need to document it so it's easier to train up the next person. And so there are some facilitators, like some of the expectations within the guidance for the guidance document and things to consider. If you want to really move from theoretical to action, is part of your HR orientation is that everyone in the organization is going to get training within the first week of their job related to system of care. That if you really want to have the right people on your governance body, then someone needs to spend the time to do a new member orientation about the work and bring them up to speed versus just plugging them in and they're lost and they don't know how to contribute. You have to invest the time in the documenting of the journey and the benefit of that. And that just helps you continue the operational aspect of it when a new staff comes on board, or to replicate it. Like, oh, we did really good work in this county. How do we now get it to another county? Like, you have to be able to transfer that knowledge over time.
Excellent point.
This is Jane, also from FREDLA. I just wanted to chime in that another way to sustain the work is to get it in some form of legislation or regulation. Get language, system of care language, get in statute, advisory councils, membership of advisory councils, those kinds of things, so that as you have changes in administration and such, those things are in law, if you will, law or regulation. Of course, they can always be changed, but it takes more time to change them. So I think that's a very helpful strategy while systems of care grantees are in the process of, either building their system or ramping down as their grant is ending, to try to get language in to statute somewhere. I remember in Maryland, as one of our grants was wrapping up, we were able to get language, just the values and principles of system of care and about family-driven and things, into the governor's office for children language. So I think trying to get that language into anywhere you can get it is really a helpful strategy also. Thanks.
Thanks, Jane. Were there other questions or comments? Anything else about the data or strategies? We've got a few more minutes. Okay. If there's nothing else, thank you so much for joining us today and being part of the discussion. We are always available to help support you in implementing, as in the TA Network has hubs that cover just about every part of system of care with experts and resources to help. Tiara wants to remind everybody, please take the survey. It's very brief. It will pop up right after this. And if you have any other questions, feel free to reach out to us. Thank you very much.
Millie, I just want to remind folks who are on the line that are from family-run organizations. FREDLA just sent out earlier today a link to our National Family-Run Organization Survey. So if you can kind of keep your eyes peeled on your email for that, for anybody who's with a family-run organization, we would love to be able to include you in our next process of analyzing the data.
Thank you very much. Everyone have a great day.